Hello, I'm going to talk to you a bit about how this program can help you. This program is designed as a 4-week program, and it includes education and assignments and this telephone group. And in the telephone group you'll have an opportunity to talk about your experiences with the assignments and to ask any questions. And each week, new pain management tools will be introduced in the online program as part of your assignments that you can listen to. So you can discover which one of these ways of dealing with pain, increasing your comfort, work best for you. Research indicates that the best way to manage chronic pain is a multimodal approach, and this means utilizing many different modalities, from medical to movement to mind body to physical. All of these together can be helpful. And not everything is going to be helpful for every person. All of the information that you're going to learn in this program and all of the tools you can use along with any medical treatment you may already be receiving. And even if you've tried many things and you're really concerned that maybe something can't help you, you will learn effective tools in this program that you may not have considered that can help increase your comfort. So I'm going to invite you to be curious and open and just experiment and try some of these assignments, trying out some of these new ideas to see how helpful it can be for you. And you also may have many things that you're already doing that are effective for you, and you can continue to do those. This just gives you more options. So what will you learn as part of this program? There are many things, and each week there'll be more information. But in general, you will learn about how to bring more comfort to your mind and to your body. You'll be learning about pain and the causes of pain, but more importantly, you'll be learning about comfort, how to increase your comfort. You'll be learning several different pain busters, but they include mindfulness meditation and relaxation techniques, imagery, developing a personal plan for reducing discomfort and pain, replacing thoughts that hurt with thoughts that help, and a big long word, psychoneuroimmunology. You'll get information about these in the program, and you'll also have resources so that you can do more research on your own. This week, you'll be learning about pain from many different aspects, including inflammation. And to personalize this, understanding your pain, how to talk to your doctor about pain, your relationship to pain, and interventions, movement, physical and medical interventions, and mind-body interventions. And at the end of each week, and this week is included, there will be assignments. And if you click on that and listen to the assignments, you will be guided through them. And this week, the assignments will be keeping a painless log, brace, release, and breathe, and building a path to comfort. It's important to listen to the education piece first before going on to the assignments, because the assignments will make so much more sense and be so much more helpful if you get the education first. And this week will be longer than all of the other weeks because there's quite a bit of information that is important for you to have. So not to be concerned that each week will be very long. This one has most of the education in it. Next week there will also be quite a bit of education, but as I said, this is one of the longer weeks. You are welcome to just listen to this, or you can look at the PowerPoint on your computer while you're listening to this, or you can look at the notes that are available for you that are much more detailed than the PowerPoint and read along with that if you wish. Whatever works best for you, however you learn best. If you're more comfortable just listening and you can focus well just listening, then please, I invite you to do that. If it's easier for you to take in information by reading and listening at the same time, I'll encourage you to do that. And because this is a self-paced program, you can turn it off at any time and come back to it whenever you wish. So while listening to it, it's important for you to be as comfortable as possible. So wherever you're sitting, it's important to sit up so you can stay focused, but allow yourself to feel comfortable and just take in this information. So we're going to start with just reviewing a little bit about multiple sclerosis. And there's much more detailed information on the handouts that you can look at on your screen or print out. But I'll just go through a little bit about multiple sclerosis. So multiple sclerosis, MS, primarily affects the central nervous system, the brain, spinal cord, and optic nerves. The name multiple sclerosis comes from the multiple areas of scarring that characterize the disease process. MS symptoms may be mild, moderate, or severe. And the course of MS can include relapses and remissions or progressively increasing symptoms. And symptoms vary among people and even for the same person day to day. So no two people will have the same experience living with MS. As a result of the inflammatory process in the central nervous system, people with MS can experience many different symptoms. And we'll talk about inflammation later and its relationship to pain, but I want to note here that inflammation has a relationship with MS. And what we'll mostly be talking about in this program is the discomfort, the tingling, the numbness, or the painful sensations that can come along with MS, can be one of the symptoms. And there are 4 different types of MS: relapsing remitting, secondary progressive, primary progressive, and progressive relapsing. And more details about each one of these types of MS is in your handouts.